You are watching Wide Field with Vivian Birchall. This is Wide Field.
Welcome to Wide Field. I'm Vivian Birchall, your host. Today's topic is the blood plant, and we'll dig deeper into what that means. And my guest is Dr. Wilfred Ngwa, who I am going to let introduce himself with his many titles so that I don't mess them up. Dr. Wilfred, welcome to Wide Field.
Oh, thank you, Vivian. So yeah, a little bit about myself. So I'm Dr. Wilfred Ngwa. I am based at Brigham and Women's Hospital. I'm the director of the Global Health Catalyst Program. And I'm also one of the professor at Harvard Medical School. I'm a distinguished professor at ICT University as well. But more importantly for me, I think I'm a scientist. Which is one of the things that I'm looking forward to talking about with this blood plant.
Welcome again. And it has been a year since I first heard about this blood plant.
Right.
What is this plant and why is it commonly referred to as the blood plant at your lab?
Yeah, it's a blood plant because of the hemoglobin. So last year, we had the open day at Brigham and Women's Hospital. And this was one of the, the plants, one of the science that was highlighted on that day. And one of the things that really stands out about this plant is the fact that it has hemoglobin. So that's why it's called a blood plant. You know, as we humans, we have blood. What makes the blood look red is the hemoglobin that's in there. And this is very important because the hemoglobin transfers the oxygen when we're breathing through our lungs. So it carries the oxygen from our lungs to other parts of our bodies. And that's why we are alive. And so it's called a blood plant because we found out that it has unusually high amounts of hemoglobin, even more than what you'd find in humans, which is quite surprising. What is not really surprising is that, plants do have hemoglobin. So it turns out that, people already knew that since 1938. There are some papers that were published showing that plants can have hemoglobin genes, but the only thing is that plants do not express these genes. So they may have the genes, but they don't need to express them. And in this particular case, we found a plant called a blood plant because it can express its genes in a very profound way so that it can produce very high amounts.
What is the scientific name for this plant?
All right, so we did this study with the Smithsonian Institute in Washington, and the whole idea was for them to kind of identify what this plant is. They were able to do all the genetic studies, and they were able to narrow that down to a genus. The genus of the plant is called Justicia. But until now, they have not been able to identify the species. So it may be that this plant will become a new plant. It may have a new name. So we're already thinking about possible scientific names for it in case we don't find a species. Then we have to name it.
All right, I could suggest some names. The Vivian plant.
There you go.
But more seriously, how did you determine its medicinal values, and how many institutions are collaborating in this research? I know you've mentioned the Smithsonian.
Right.
Can you tell us a little bit more about that?
Yeah, so the manuscript we published recently basically included collaborators from Brigham and Women's Hospital, so the Harvard affiliated hospitals, and then we have the Smithsonian Institute, and then we have the PC Health Services in Cameroon. And then we have the University of Boya, that's also in Cameroon, because part of the history for this plant was actually can be traced back to Cameroon. So those are the four collaborating institutions so far.
And how did you determine its medicinal values?
Yeah, so it actually, we had to do some science on that. So it turns out that people actually use this plant in folk medicine, in Cameroon. But, so once I first got introduced about this, it's a long story. I don't want to go into that, but, once I got introduced into that, I thought the most important thing to do is that a lot of people in the world, 80% use phytomedicines, herbal remedies. But the key thing there is that, there is really no evidence or science done to really prove what's in those plants. So the populations knew that this could help with their blood. So anybody who had something to do with issues with blood, they would, take that as a herbal remedy. But nobody really knew what was in this plant that was helping. And so part of the science and the excitement here is really kind of look at, so we took this, then brought them back to Boston. So we did some research at some of the Harvard core facilities to kind of look at what was really in this plant. And that's where some of the science began to reveal that, okay, it does have hemoglobin. It also has a lot of components that we found in blood plasma. So it's kind of remarkable that this plant would have that, those remedies, but we had to do the science. In fact, when we did the first time, we couldn't believe it. So we actually had to do like 3 repeat studies, looking at different scientific ways to ensure that what we were really seeing was true. But that's the fun part, being able to do that and then discover that it had not only hemoglobin, but other blood components.
When you said to discover that it was true, have you done clinical trials yet? It's going to tie into my next question, where your research has been peer-reviewed and published in our science journal. If you could please explain the components of this research that were peer-reviewed.
So the research basically included 3 parts. There's one that's done in a Petri dish. One was done in animal studies, and then we also reported the factors, the studies results from human use of this. So these 3 components really set the basis for now to then look at, depending on what application we want to develop out of this, whether we actually need a clinical trial or not. So I'll just summarize some of the findings here. So the first one, the in vitro studies, which are really doing in a Petri dish, where basically they kind of look at, one, what is in this plant. So we're able to do spectroscopy studies to show that it does have hemoglobin. But this is not in humans or in any animals or anything like that. So you can carry out some light studies using light to kind of see signatures of this hemoglobin in that. The second thing we did was we also looked at cells. So cells that have been taken out of living things. So we looked at blood cells called endothelial cells. And we also looked at cancer cells because we work in a cancer research facility. We just kind of looked at whether it would have any effect on cancer cells. So we exposed this, and from these in vitro studies, in vitro means in a Petri dish. So from these studies, we showed that, yes, it did have signatures of hemoglobin. Number 2, it was not toxic in the blood cells that we looked at, the endothelial cells. There were some initial evidence that this may have an effect on some cancer cells, but particularly prostate cancer cells. But we have to look into more detail what the mechanism for that effect was. So kind of developing that as an application. All right, so then the second thing we did was we actually did tests in animals. So we created a situation where the animal became anemic. So we created anemic conditions in the animals, representing a case where somebody has an accident and loses blood. You draw blood from the animal as if they lost an accident. And then we treated them with these extracts that we kind of isolated from this plant. And then we try to see whether they can recover, how fast they recover. So what we saw was that the animals that were treated, recovered very fast, when we were treated with this isolated extracts compared to animals that were not treated with them. So what that tells us is that there's a potential for developing this as a remedy for creating anemic conditions. These anemic conditions can be either acute, as in the case where you have an accident and the blood loss is very fast, or maybe it's in chronic anemia, where it's probably because you have bone marrow, or you have conditions that are reducing the amount of hemoglobin that you have. All right, so that was the in vivo studies in animals. We also did do toxicity studies in the animals, and we showed that they were not toxic in animals. So that's a really good thing. And then the last thing we did was we actually did a survey of the people who've used the plant, extracts from this plant. And what we tried to find out from them were, one, how did it help you? And number two, did you feel any side effects? And so those studies were able to actually show us that, they were beneficial in humans for anemia. That was the most dominant effect that was found. And then secondly, that they were not toxic. Only one out of about, 0.3% of the people recommend said that there was some effect. One reported was frequent urination. The other one was diarrhea. These were very minimal and may not actually be connected to the plant at all. So, so our conclusions from the study was that this was very safe, and that it could have these benefits in anemia. So which then sets us to your question about clinical trials. So depending on the application, we may or may not need clinical trials. Okay, so I can talk about the applications that are coming out so far from this data.
Yeah, which was going to be my next question of,
Yes.
how can they be applied? How can the findings be applied?
Yeah, so we're thinking about, and I presented this at Brigham and Women's Hospital as well, in November. So there are really three possible applications that are supported by the evidence right now that can be developed from this. So one is thinking about anemia. So people who, suffer from anemia. So you can actually use this based on the results we found in the animals, but also from what people are reporting. It's possible that this can be used to address anemic conditions, especially chronic anemia. So in this case, I'm talking about chronic, not the case with the accident right away. That needs to be tested in clinical trials. So for anemia, you can use this. So we can actually develop this into a nutraceutical, or tablets, like iron tablets are developed for people to use that for anemic conditions. The advantage here would be that this will be heme ion. So it's not, you can get a heme ion from there. It's not, the normal ion that you would get from a synthetic ion. So we know from studies that heme ion is more readily absorbed in your small intestines. So if you actually use that as oral, through oral administration, then, that will be readily absorbed, and you can get a better, more faster response to anemic conditions. So that's one application. Right now, we're actually looking at filing an NDI to the FDA for that. So that doesn't really need a clinical trial. It's just like a supplement that you get.
What is NDI for people who are not scientists?
Yeah, so NDI is just basically showing that this is safe for non-dietary. So, so it's like a dietary supplement, just showing that it's safe for you to consume. Okay. So what we're going to do is that we are going to show all the data that has been published that's available on this. And the FDA can now evaluate that and allow you to actually develop products that people can use directly as a supplement or nutraceutical. Then the second application, which is kind of very exciting as well, is looking at this as for food applications. So, you may have heard about, the development of burgers, for example, that now use artificial hemoglobin. And the advantage of that, getting hemoglobin from plants, to create burgers, because what really tastes in your burger, what makes it taste the way it tastes, is really the hemoglobin in the meat. All right. So, but if you have plants, and plants can produce the hemoglobin, you can use the same in your burger, and that can generate, the same kind of taste that you want. But the cool thing there is that you don't have to kill an animal to get the hemoglobin from there. And so, people are very excited about this because it can help, address global warming. We know that food cultivation, like animal cultivation, is responsible. The footprint can be between, up to 40% of greenhouse emissions. Studies show can be coming from those kind of agricultural practices. And so, by moving to generating, hemoglobin from plants for our burgers, would really save the planet, as well. So that's a very exciting application that we want to develop from this as well. And for that one, we also don't need a clinical trial. We just need to develop. What we'll just need now is to set up populations that can taste the burger and show that they like it. So we'll probably create a control group where you have the normal burger, and you have another group where you have the burger with the plant hemoglobin, and then you're going to taste without knowing which one you are tasting, and you can tell me if you know the difference.
I'd like to be a part of the people sampling.
Right. Exactly. Yeah. So that will be the kind of clinical trial that you would say it's not really a clinical trial, but so we're working on that. And then the last application that can be developed, which we need clinical trial for, would be for developing this for a blood substitute. So one of the biggest needs that we have, you have to always donate blood all the time and do transfusion for blood. You have to always check the blood group of the person. And then if you're going to places like, the war front or to space, you may have limitations in, refrigerating blood and carrying that to the war front or going that to space. So, and then if you have an accident somewhere, blood may not be directly available. But if you think about developing a blood substitute that can replace the normal functions of blood, like carry the oxygen, like hemoglobin does, then this is a really great application because you can use that for accident victims, for acute anemia. You can use that for, for in the war front, for the US military, for example. You can use that in space, like for NASA applications as we think about going to space, because we've actually developed this into a powder that you can just reconstitute into blood, And the great thing there is that it doesn't need a blood group, so this is a blood group neutral. And then we can also think about applications where, you can do blood transfusion for people who don't want human blood. There are some religious objections to that. There are some religions that don't like blood transfusion. So if those people, you have patients there that need blood transfusion, they may be candidates for this. And I should say that, blood substitutes, it's a big field that since the early 2000s, there's been a lot of excitement to see what I can develop that. It's a multi-billion-dollar industry. But so far, there's no widely accepted blood substitute because, there have been always failures in clinical trials because free hemoglobin or other blood substitutes, they interact with your body in other ways that can create toxicities. So the great thing we're excited about this one that's different is that first one, we've shown some safety already. And then number two, we found out that from the science that this is actually not free hemoglobin. It's actually well stabilized. And so, so we have hope there that, it can actually be a really good blood substitute. But to do that, we will have to do clinical trials. In fact, we actually want to do some more animal studies first in a larger cohort study, building on the paper that we just published. And then just to kind of vary the doses of this, of what we administer, and then see what is safe and where you get a very good efficacy. That will then inform what we use for clinical trials.
So I know you have glazed over what products you could create from this. You've talked about the powders. Is there any other product that this plant that can be used from this plant that you haven't mentioned?
Yeah, so we actually have some pending work that we started to do before COVID-19 struck, which was looking at sickle cell anemia. It turns out that this can actually influence the has some anti-sickling properties. So it can actually help with people who are dealing with sickle cell disease. But that needs to be investigated. We haven't done very focused research on that. There is a good hypothesis, hypothesis can be developed that this may work for that case, but we still have to investigate that. And then we have also been talking to some NFL players who are very interested in looking at how you can combine these for, because it can bind oxygen, it may lead to, real high performance.
And then, which would bring the next question, wouldn't that be considered as blood doping?
I know, right? Yeah, yeah. You know what? So that's a really good question. And I think, at this point, we first want to, once we think that that's going to be a case that, whatever, the doping, whatever organization needs to check that to see whether that's something that will be considered under that category. My initial thinking is that it may not be, or it's the same like if people take iron supplements, they may argue that it's going to help them with their oxygen. So in this case, it may just be a more effective because of the higher, faster response, because can be more readily absorbed. People can use that very, so it may be higher performance. So in that case, I'll let the jury, whatever organization decide,
And then, of course, there's the whole conversation. If it's we're getting it through the burgers, it's food. Then how would that be considered doping if it's a food?
Right. Yeah.
But again, like you said, I think we'll get to that phase, and I'll bring you back to the studio to talk about any research from from those organizations that are trying to make sure that athletes do not.
Exactly. Yeah.
So when you think of what do you think such products might be available, and what industries might be transformed as a result of this? I know you have mentioned potentially the military could use this, the astronomy community could use this, and their hospitals for anemic patients.
Yeah.
Have I left out any other industries? And can you speak more to that?
Yeah, so the key industries here would be the nutraceutical industry. That will be very fast. I think that's the product that we think can come out. I mean, before COVID-19 struck, we are planning to get that out in the third quarter of this year. Because of the NDI, we have to file in this paperwork to the FDA just because of that. And then number two, the food industry. So that one also, we already found a chef who is really, going to help develop this, and a very great, actually a great chef. So we think that very soon, we may be able to invite you to come and do the control study where you taste the burgers.
There we go. And the tea.
Yeah. So that will be a second. Yeah, that will be a second rollout. And then teas. Yeah, teas are another very easy one. So we actually have tea products that were showcased during the Discover Brigham session in November. So we have those available. So and then the third thing would be, a very important one. People are very excited about that one. So that's the blood substitute. So I'm saying that, there are a number of, good signs that this will be a good candidate for a blood substitute. One is that, we found out that it's safe. So it's quite safe in the animal studies at least. Number two, it can bind oxygen very well. So we did see that it binds oxygen. So we actually did a study with next collaborator I should probably mention in the Boston Children's Hospital. And so we show that it can really bind oxygen with really high affinity. And, so very similar to what you get for hemoglobin as well. And then the third thing we found out was that, we can convert this into a powder, and the powder is stable over months. So it means that you can reconstitute that into a blood substitute by just, dissolving that in water, and it will still have the same components like you had months ago. which is really good because if you're going to apply that in the potential applications we're thinking about, like in the military or in space, or you want to have it stable over time. So we are very excited about this now, and so the main thing now is COVID-19 permitting, we want to be able to start moving towards the clinical trials.
All right, and when do you think the final products would be available? Some of those.
Yeah, so for the nutraceuticals, like the teas and the anemia treatment supplements, like I said, we're thinking of getting that out this year. So, with COVID-19, depending on when we can go back because of the freeze in research going on now, if we can get that back, I think, the shift will be by end of this year or early 2021, which we already have the products out for commercial products. And then for the burgers and food applications, it doesn't only have to be a burger. We're thinking about other, foods that you can use for that as well. That one also we plan to roll out in the third quarter of this year. With COVID-19, you may have to shift another quarter as well because of the delays in that case. For the blood substitute, it would take, I would say at least, between 3 and 5 years for us to, begin to get data in a clinical trial that would allow you to transition that into use in patients. One, because, phase 1 of the clinical trial, we can get to the clinical trial by 2022 because we already have most of the data. But then the clinical trial itself takes time. So you have to, first of all, check, just like for vaccines for COVID-19, it takes time for you to get that or for the therapies, So, so I think that it would take a longer term to get the blood substitute, about 5 years, I would say.
Yeah, and I know at the start of this, you introduced yourself as working with Brigham, and during the conversation, you've mentioned Brigham. What is the role of Brigham in all of this? And are there other institutions within Massachusetts that you're working with?
Yeah, so Brigham actually provided, we got some funding from Brigham to support this work, from the Brigham Research Institute. And then we've been recently now collaborating. There's a company that's looking at, investing into this to get this further work like the clinical trials. They want to invest into this for the long term because they've seen the potential for that. And so, so that's the main institution that's done this. Dana Farber, we've also filed patents. So we have a number of patents that have been filed from this. So we actually working with Dana Farber, so there will be ones to kind of license these to the company, and so there are really 2 patents. One of them is, in the methods that we've been able to use to isolate this hemoglobin with much more better, efficacy, to show the better efficacy that we're seeing. And then the second one is, basically we've got, to be able to grow it in the United States. Since we don't even know the species yet, so we believe that this plant was able to evolve from other species. And so now we actually got Department of Agriculture approval to grow that in the United States. And so part of the patent is with respect to that. So to grow that in the United States, we have the license to do that.
So no other person can grow it in the United States?
Exactly, yeah.
Right, I was saving that for later, but since it has come up now, I guess it's good to know that at least the plant is being locally grown or attempted to be grown within the United States.
Yeah.
And did you want to say anything, regarding that, the growth of
So we've actually, grown, started growing that in Florida. So actually, and that's a very exciting thing because, the discovery, because the plant is kind of unique. We actually believe that part of the reason why it's generating hemoglobin, like I said, plants do have genes of hemoglobin, but they don't express those genes just because they don't need it. But in this particular case, the plant, we believe the hypothesis here is really that the plant, because of the environmental conditions, it really needed to produce this hemoglobin. We have a reason why we think it had to do that. part of it because of the temperature conditions that it was in. And so Florida and California as well, they provide the right climates that you can reproduce those conditions. You can also do that in Massachusetts, in Boston, but you have to create a greenhouse. We actually have somebody who's offered, the person has a number of hectares out in Massachusetts, and he's offered that we can set up a greenhouse there to grow this. But obviously it may be easier to do that in Florida or California, or, where we have much warmer conditions.
Yeah, and how safe are the plants? Can someone just come and pick plants?
Right. I know, right? I mean, I think it's you have to kind of treat it as a, if somebody comes to harvest from there, and then, you have to have some security, obviously, to monitor that. So
I don't want to get into it as just,
yeah.
I don't want to get into that, but before, let's get back to the history of this plant. I have asked you before, but for the benefit of our viewers who are learning about this plant for the first time, how did you become aware of the plant? I know you glazed glazed in the beginning, but tell us more about the history.
Yeah, so I'm actually born in Cameroon. So I traveled there in 2016, I think. I remember it's 2016. And so I found somebody who was drinking tea from this. And so was saying that it was a remedy for their blood problem. They had an accident, and they were taking that to help them with their blood. So, but I was very skeptical, obviously, as a scientist, like I said, how can that help your blood, and actually looked very stupid because everybody around that area thought, how can you not know? Were you born in Cameroon? How would you not know?
You consulted the grandparents.
Right. Exactly. So, obviously I look like, wow, so you come from Harvard and you don't know. I look stupid. So I said, okay, maybe out of that, you're going to do the rigorous science that's you need to do. I'm going to prove you guys, I'm going to see if you guys are wrong. So I said, I'll take some of the samples and kind of test them. So obviously that's what we did. And actually one of my colleagues who went to test that in the beginning, I still remember when she came back from the core facility where we sent this to be tested. When she was going there with one of the extracts, they were like, oh, no, we don't do human blood here. We don't test human blood. So she had to convince them that, no, this is not human blood. This is from a plant, But yeah, so that was kind of really, that kind of discovery, that we made from, accidental, because it was not really, my interest looking out for that. But I found this whole thing. The people made me feel stupid, so I said, okay, I'm going to bring some science to it. And then voila, we found this very interesting discovery. And
speaking of that, you already mentioned some of the traditional uses that people in Cameroon use the plant for. So I'm not going to get into that. But what mechanisms are in place to give back to this community in Cameroon where you discovered this plant? They deserve that.
Oh, thank you. I mean, that's a very important question. And I think I may have had these conversations to you offsite about, the idea of, what mechanisms you can really use to give back to those communities. And I think you have a brilliant suggestion. And actually, I tested that. People asked that also at Discover Brigham last year. And we've kind of, talked about this with a number of people, and they agree with your idea. A lot of people believe that that's the best way to go. So we've kind of settled on the idea that one way to do that is to create a foundation where some of the royalties from sales of this use of that license can go to that foundation, and then it can be used to invest back in that community, like in education and training and supporting healthcare in that community. But 120% we are committed to that. And I really want to thank you for that idea. I think it's a very good idea where people kind of, think it's really good, because in that way, you can make sure that the money is not being misused in some ways. You can direct that back to the community. Because one of the things people keep saying was that, the governments, if you want to go through governments, corruption and things like that may influence that. But the foundation really creates a good way to do that, and give back to that community. So that's the way we're going to go with this. And I think it's a brilliant idea.
Yeah, if you don't support those communities, we're holding you accountable. I will personally hold you accountable.
Yeah, I cannot dare not do that, because actually, we actually owe some of the intellectual property, I would argue, from that community.
Excellent. So what should we be looking forward to in the future, and how can people who are interested in learning more about this plant contact you?
Yeah, so we're very excited about this, from food industry to nutraceuticals to, I just think that, very soon this is going to be something that, is going to be coming near to the supermarkets near us. And I think that, from the perspective of people, this is going to be a really good, I look at it from, working in healthcare. For me, it's really important that we can provide solutions to healthcare that, can have a high impact. As you may know, 1 in 3 people in the world is anemic, and so, and people, a lot of people, can't, the solutions that are out there right now to address anemia don't work for everybody. Iron supplementation, it's not appropriate for everybody. People who are in regions where they're endemic of malaria, they've seen that it wouldn't really be a good thing for them. And then number 2, there's a lot of other side effects that are related to that. So now coming from this with a very, the product that's coming from heme iron, which is readily bioabsorbable in your stomach. So we're really excited that we can provide a solution or a product that will really have a good, or meet the need out there for healthcare, especially for, and that's really make my heart beat, people, for pregnant women who are usually very anemic, for kids, this will be a very good product for them. So that's something that I'm very happy about. And then obviously from the food industry, actually we've had an investor who was based outside of the United States. I was really thinking that for the food industry, the burger idea maybe more exciting from the United States market, not necessarily for, for other economies, and so, but I think that what excites people in that particular product is the idea that it can reduce the carbon footprint. We're actually writing an article now for Science, which is very interesting because, the focus of that will really be focusing on the idea that by moving to plant-based hemoglobins, source hemoglobins, we can move forward to reduce the carbon footprint, can help fight global warming. So that's very exciting. I actually gave a talk recently in New Jersey, and after that, there's a woman running after me saying, "Oh, you know what? You are my hero. You're my hero." I said, "Why?" He said, because of the global warming thing, there are potential application for this to save the planet, and people cannot wait, to see how those kind of products begin to come out. And so we're excited about that too. But I'll say that, finally, the most exciting thing for me is having a potential blood substitute candidate. This is something that we really want to, we're very excited to study. I mentioned that we already have some very promising reasons why this may be a good candidate for that. And now we have, we're just waiting for COVID-19 to permit. So we really have a company that's interested in investing in this. So we are looking forward to that, even though it's much longer term because of the research and rigorous science that needs to go into it. But we're very excited about the potential application.
Right. Well, I was intrigued by this plant from the get-go, and that is why, as my media and medicine class project, I chose to tell the stories about this plant. But, I know one of the recurring themes in our conversation has been, there's people interested in investing this, but I also know that one of the backgrounds has been to try and bridge the healthcare gap for low and middle income countries. And we know that there is a history of investors hiking prices of products until they become inaccessible to people who most need them. So what measures are in place to make sure that there is affordable products for low and middle income economies, which ties into what the Global Health Catalyst is all about?
Exactly. And the Global Health Catalyst, kind of mentioned now, there's a lot of, so it's become a lot of faculty from different institutions now and are collaborating with us on this, including in Africa, partly because, they understand the goal that you just mentioned of making sure that everybody has access. I mean, the World Health Organization, one of their big mantras is healthcare for all. Want to make sure that everybody has access to healthcare. And so, so because of that, because I'm really an integral part of this global health catalyst and these partnerships with different institutions, it's a priority. I can assure you that the priority is to make sure that not only populations that have money can access this, or want to make sure that the people in resource poor settings can afford it. And frankly, even the clinical trials, we want to make sure that it's not just populations in the United States. So it's going to be multi-center clinical trials, so involving this population, so you can make sure that you have a good representation in that. So to make sure that that's happening, that's one of the reasons why I'm actually very important. I want to make sure that I'm part of this company that's being formed, to spin out these products. So I'm going to be an important part of that to make sure that we don't hike prices. I want to be part of this. I really believe that, because of the way this was discovered, we should make sure that people have access to it in these resource poor settings. So I'm committed to you 100%. So we're going to make sure that happens.
So people might be interested in learning more about this plant on their own. Where can they find the plant or information about the plant?
Yeah, so, we actually have a sample of this plant at the Smithsonian Institute in Washington. And so it's a dried specimen, which makes you can go there, you can see how the plant looks like. So you can also be able to carry out your own research if you like to. And I also provide, samples of the pictures of this plant so you can see. Like I said, we actually have it growing in Florida now. And so, if you want to see a sample or a picture of it, you can contact us and we'll be happy to share that.
All right. Well, thank you for your contribution to science, to research and education. And thank you for taking the time off your busy schedule to be my guest. But before I sign off, is there anything that we haven't talked about that you would want our viewers to know? And how do they contact you if they're interested in learning more about the products? Absolutely.
Yeah. So yeah, in terms of the contact, definitely my email, you can email me directly. It's my last name is Ngwa, Ngwa, @bwh.harvard.edu. So you can reach out to me. Obviously, they can also contact you and you can connect them to me. But one thing I just want to say is that, we want to say that at this time of COVID-19, people have actually been asking us, is this one of the products that can have an impact there? One of the things we've seen is that there is potential to look at these products that I've talked about in that applications there as well, because they've talked about people being anemic when you're infected with COVID-19. So that's one of the things that we're also investigating to see whether this could be of value in that direction. So we're very excited about this, and I think that we want to thank you for this opportunity to kind of talk about these exciting results and communicate with the public about this. And I think that you really provide a good platform for us to education and awareness about science. And I know that the questions you ask are very good in the sense that they help communicate some of these ideas in less scientific terms so people can understand them. Yeah, and you may know people invest a lot of money into this. Even Bill Gates, one of the foundation actually launched one of the initiatives was looking at, just communicating science to the public, so they can understand. Even the United States public, so you can see where your tax dollars, what they are doing. And I'm so thankful that, through the platform of ActonTV and you, that you can communicate some of this science to people. And obviously, if there are any questions that people have, I'll be very happy to get back answers.
Gary, I'll pass on as many as I can to you. But again, thank you for your contribution, and thank you for being my guest. And to our viewers, thank you for watching Whitefield. Till next time.